If you're in braces or aligner treatment, your orthodontist has probably asked you to wear orthodontic elastics. Well, what are they and why are they important? In this video, we will review this important topic and answer many common questions we get so that you can get the best results from your treatment. Orthodontic elastics are simply a loop of rubber that has shape memory. That means that the rubber band wants to return to its original shape while it's being stretched. Why are they important? When you hear your orthodontist say bite or occlusion, they are talking about the relationship between the upper and lower teeth when they're in contact with each other. Correcting bites is one of the major goals in orthodontics because if you have a bad bite, also known as a malocclusion, you won't be able to chew properly and your teeth may wear down a lot quicker over your lifetime. Our goal is to get your upper and lower teeth to fit together like this in what is called class 1 occlusion. More specifically, we want this cusp tip on this molar to be in this groove of this lower molar and the upper canine to be between this canine and this premolar. So what does that have to do with elastics? Well, braces with the brackets and the wires are great at getting your teeth aligned in each respective jaw, but they don't do much to help your upper and lower teeth fit together and correct your bite. Orthodontists use elastics to apply forces in directions that are not possible with just braces, which is why elastics are extremely important. How do they work? Elastics work by applying gentle yet consistent pressure in your teeth, just like your braces do. This gentle, constant pressure pulls your teeth in a particular direction to correct a bad bite. What are some common bite issues you treat? Some common bites that we correct on a daily basis are class 2s, or what many people call an overbite, class 3s, anterior open bites, and cross bites. For a class 2 bite, we will use class 2 elastics in this pattern to pull your upper teeth back and your lower teeth forward. For a class 3 bite, we will do the opposite to pull your lower teeth back and pull your upper teeth forward. We can use a posterior box, triangles, or an anterior box pattern if we want to pull the teeth vertically towards each other. For cross bites, a button will be placed on the back part of your tooth so that an elastic can be worn to widen one arch and narrow the other. There are also variations to each pattern to achieve a particular goal. For example, if we want to bring all your back teeth together while at the same time correcting a class 2, we will use a class 2 vertical elastic to achieve both goals. For a complete list of common elastics patterns and where to attach them, you can visit our website by following the link in our description. So how long do I need to wear them? Elastics must be worn at least 20 to 22 hours a day. Anything less than that will not move your teeth. That means that they have to be in at all times except when you're eating or brushing your teeth and must be worn when you are sleeping. Sometimes you may be asked to wear your elastics only half the day, but this is typically when you have reached your goal and we want to hold your teeth in that position until the braces are removed. It's extremely important that you are wearing your elastics. Imagine running up an escalator the wrong way. The moment you stop running, you start going backwards. It's the same with your elastics. The moment you stop wearing them consistently, your bite will start shifting back to its original position. So you have to stay consistent or you will lose your progress. How often do I need to change them? I recommend changing them as often as you're eating or at least 3 to 5 times a day. The longer you have them stretched, the weaker they get, so the amount of force will decline and they won't be as effective. Do they hurt? Because the elastics move most or all your teeth at one time, the level and duration of the pain is very similar to when you first get your braces. Usually the first 3 to 5 days are the worst, but if you are wearing them consistently, the pain completely disappears after the first week. If you wear them inconsistently or you remove them when they start to hurt, you are constantly restarting that painful process and it will continue to hurt. Can I wear elastics with clear aligner treatment like Invisalign? Yes, an orthodontist can design hooks or elastic cutouts on your trays to hold an elastic. What happens if I don't wear them? If you don't wear your elastics, then the results of your orthodontic treatment will be less than ideal and your bite will not be corrected. As mentioned before, that means your teeth may wear down quicker over your lifetime, or you will not be able to chew as well, and your teeth and smile won't look as good. Sometimes with non-compliant patients, orthodontists will use an appliance that you can't remove that accomplishes the same goals as elastics. There are many types of appliances for this purpose, such as a herps, forces springs, and power scopes. Trust me, elastics are much more comfortable than these appliances, so just wear them. What if I'm allergic to latex? Latex allergies are fairly common, and if you have one, please inform your orthodontic office immediately so they can give you latex-free elastics. Always remember to check your elastics bag for the words non-latex before you put them in. What if I lose my elastics between appointments? Just call your orthodontist and you should be able to pick up more at the front desk without an appointment. Easy. I forgot the pattern. What do I do? Do not attempt to put in elastics if you're not sure of the pattern because you may move your teeth in the wrong direction. Call your orthodontic office to confirm the pattern first. At our office, we can text you a picture to show you the correct pattern, or if you are really unsure, you can always ask your orthodontist if you can come in again so they can show you. To avoid forgetting, I suggest taking a picture of your teeth with your elastics in so you can use it as a reference. Does the strength of the elastic matter? There are many different sizes of elastics and your orthodontist will select the right one for your particular situation. For example, for a longer span, I generally use a lighter elastic so it is more comfortable and easier to put in. For a shorter span, I choose a heavier one so that there is enough pressure on the teeth. One common misconception is that a heavier force is better than a light one. Actually, light forces are just as effective, if not more effective, than a heavier force, and the most important factor is the amount of hours and consistency of the wear. I keep forgetting to put my elastics on. How can I remember? It's normal to forget. I suggest keeping a bag of elastics everywhere you go, such as your backpack, your purse, your car, and at home. You can set reminders on your phone like, "Hey Siri, remind me to put my elastics on in 10 minutes. Or you can download this free phone wallpaper and set it as your lock screen to remind you to put your elastics back on. In all seriousness, any sort of reminder you can give yourself using your smartphone will do. We understand that it can be frustrating to get elastics in at first, but just be patient. If you wear contacts, you will understand the struggle of trying to put in your contacts for the first time. Trust me, as a small-eyed person, I know it better than anyone. But the more you practice, the faster you get at putting them in, and the pros can put their elastics in under 10 seconds. You can try attaching it to the furthest tooth first, then stretching it to the front, or vice versa. Different techniques work best for different people. You can also use an elastic tool to help place the elastic onto your back brace, then use it to stretch it forward to the front one. A significant portion of orthodontic treatment is dedicated to elastics, so if a patient wears their elastics as instructed, they will often finish their treatment ahead of schedule by many months. So if you want to speed up your treatment, you want to wear those elastics as much as you can. Remember, nothing great is achieved without effort. As the legendary orthodontist Wick Alexander once said, effort equals results. Here's a case we just finished recently where our patient wore elastics extremely well. These are her initial photos. There are obviously some areas to improve on with her bite because she's slightly class 2. This is her at her debond visit. Her gums are still a little bit swollen, but we're very pleased with her result. As you can see, we achieved class 1 occlusion on both sides, and because of that, her back teeth and her front teeth are touching exactly as they should, resulting in not only an aesthetically pleasing smile, but a bite that will allow her teeth to last her a lifetime. I hope this video was informative and helpful. If you have any other questions or comments regarding elastics, or if I missed anything, please comment below. As always, like and subscribe for more orthodontic tips and information. Thanks for supporting our channel. See you in the next video.